And unfortunately, everybody keeps getting hung up on weight loss and type 2 diabetes. But as you well know, when people get to type 2 diabetes, they're often very far down a pathology. And it's not, I'm not saying it's their fault, but they're way down the line of metabolic compromise. And I was over here having the conversation of like, hey, there's a whole lot of us who are doing all the things right. And yet we've still got some struggles. And this peptide, also other peptides, there's other peptides that are amazing as well, which don't seem to be getting vilified whatsoever. I don't know why this one is. It wasn't really until the conversation around weight loss popped up that people started losing their minds. It's been, GLP-1s have been on the market for 20 years. But when I started trying to have the conversation around like look at its impact on neuroinflammation, look at its effect on neuroregeneration, and as a brain expert, like we don't have any tools in that
None.
tool belt.
Mm-mm.
And it's got impacts on the cardiovascular system. It's got impacts on addiction cessation. We're now seeing the studies come out. So like a lot of data, fortunately, has come out in the past year since I've been talking about this to support what I've been trying to drive home. Parkinson's, Alzheimer's, I mean, things we don't have tools for. So diet and exercise, obviously, lifestyle interventions are always core. My entire platform for the past decade online has been all about metabolic health, strength training, eating steak. I've been telling people to eat steak and deadlift for way longer than it's been cool. And I'm glad people are catching on. And I'm glad people are figuring out that big pharma and big food are in bed together and that the diabetes industrial complex is a real thing and people are making a lot of money off of it. But I've been trying to just treat
Billions.
I've been trying to treat the people in front of me as they come in the door. It's not my job to judge their pain level. It's not if they're telling me the truth. It's not my job to judge whether or not they're telling me they're doing everything right and they still can't lose weight or they still can't get on top of X, Y, and Z. And then for me, I was hitting menopause and my autoimmune disease coupled with the stress of pushing back against the narrative for the past several years. I pushed back hard is for the
Mm-hmm.
past 5 years and I paid greatly for it. And so for me, it was like, this perfect storm of factors and my immune system just went belly up on me and every tool I had and I have every tool available, every tool I had available was not working, including all the other peptides. So that's when I pulled out the GLP-1 and decided to give it a try and started talking about it. And really, I think it's changed. I will give myself credit. I think it's changed the entire landscape. So the fact that you heard about it, I promise you that was the conversation I started, and I took a lot of heat for it. I took as much heat for that as I did for pushing back against the thing of 2020. So
Mm-hmm.
if that tells you anything, that
Mm-hmm.
there's something going on. And so, I mean, the whole functional medicine community turned on me. I have enemies up the wazoo now because I'm the GLP-1 pusher, right? I have no tie to big pharma whatsoever. I'm not even talking about big pharma. I'm talking about compounded, substances over here. And anyway, here we are. So
Well, it's so often the case. It's like, oh, people are paying attention over here, but the real conversation is over here. Like that's so. You look at the media around the GLP-1 agonists, medications, and for the listeners, again, when I'm talking about I'm talking about the trade names Ozempic and Mounjaro, Wegovy, Zepbound. Have I missed any of them? Those are the
that's
big
pretty
ones.
much it.
That's
Yeah.
it. Okay. And so that's either semaglutide or tirzepatide. And what Dr. Tyna is saying is these are peptides. So we'll refer to them with all of those different options in there. But if you look at what the media is saying about them, there is so much judgment about weight. There's this icky morality thing that's happening around it. In fact, the number of times I've had my own patients go to their GP to ask for help with this, and they get a bunch of um, sort of anti-fat, anti-obesity things that get thrown in their face instead of real help. And this is at a time where, and then of course they come back and tell me, and I hear about these things. It's just bananas. And it mirrors exactly what's happening with menopause care for women. I
Yeah.
mean, that whole being gaslit, being disregarded. Oh, you don't. Here's I had one patient just recently say, "Oh, my doctor said, well, you don't want to pay $500 a month for that." No, my insurance pays it. And yes, it is much less expensive in Canada than it
Well,
is in the
and
US.
whose job is it to judge that? I'd pay $500 a month for my hormones if it made me feel better. Like I
Exactly.
can't even imagine that. This is the
Yeah.
thing about hormones is I was never, I don't mean to cut you off, but like I never got I never got scared off by that Women's Health Initiative study 20 years ago. I just
Mhm.
kept on prescribing because I knew it was a bogus study, because I knew they used progestins instead of progesterone, and I knew
Yeah.
better because I had great mentorship around hormones. And so I was just kept on writing the scripts and
Yeah.
everybody's fine and nobody died of anything. Everybody's
Yeah.
good, you know? And I've seen these women who, had come in from like experiences you're describing,
Mhm.
and we put them on a little something something, and it's very affordable, and their whole lives are changed,
Yes.
and they get
Yes.
their I mean, there is no price I would put on pain relief, having lived with exceedingly high chronic pain for decades. Like, there's no price I would put on,
No,
like,
that's right.
I would make that money happen. Right?
Absolutely. Well,
So
tell us about actually, let me preface what I'm about to ask. So, as I was listening to you speak with the other podcasters, quite a few different interviews, I made a list of the kinds of things that you are talking about, that can be benefited by the GLP-1 agonist. So I'm just going to read that list and let's have this conversation. Autoimmune disorders, pain management, inflammation, metabolic health, of course. That's ultimately what these drugs were created for. Non alcoholic fatty liver disease, neuroinflammation. Dr. Tina, that's the one that stopped me dead in my tracks. My mother had Parkinson's, then it was dementia, and she passed away earlier this year. And
oh, I'm
that,
sorry.
yeah, thank you. And it was, there was always that in my brain. Number one, if she had actually, if her doctor had heard her at menopause when she showed up in the doctor's office with depression and was given hormones instead of an antidepressant, which she took until the day she died, maybe we wouldn't have been there. But unfortunately, she didn't live long enough to see the GLP-1s be as popular as they are. She was never offered that, as far as I'm concerned. By the way, diabetes came before all of that other stuff,
Of course. Yeah.
right? Because this is the cascade, right?
Yeah.
So this is the neuroinflammatory conversation, is the one that stopped me right in my tracks. Decreased risk of cardiovascular death, heart attack, and strokes associated with the GLP-1 medications. Weight loss, of course. Decreased addictions, especially around alcohol, the food noise conversation, Parkinson's, PCOS, and infertility. And so you're talking, this is not just the four horsemen.
Yeah.
It's
Yeah.
right. It's
And these mechanisms, I believe to be, and we're seeing in the data to be distinct. It's a different mechanism of action, separate and distinct from the weight loss. Because a lot of people will argue, oh, well, if you lose weight, don't those things all happen anyway? Yes. And we
yes,
also
and
get these
exactly.
different benefits that the peptide is imparting.